My name is Michael Bounajem. I am a third year medical student here in San Antonio. Our program is 4 years long. The first two are spent in the classroom, and the second two are spent rotating through the hospital and various clinics. After graduation, we go on to do training called residency in our specialty of choice. This residency can last anywhere from 3 to 7 years, depending on the specialty. I must be on a little bit of the masochistic side because I chose neurosurgery, the training for which is 7 years long. So in total, it'll be 4 years of undergrad, 4 years of medical school, 7 years of residency, and 1 to 2 years of subspecialty training afterward. It's a long road, and the decision to take it is a big one. For me, it was actually relatively simple. I wanted to save lives, not in any way that is abstract or indirect, but in the most literal way possible. But there's a lot to medicine that we don't know when we apply to medical school. And I would argue that none of us, myself included, really knows that this is something that we would be good at or enjoy even this far into schooling. Now, considering this is a networking event, an opportunity for us to learn more about the different schools, I'd like to tell you about my experiences since entering the hospital, where all branches of medical personnel intermingle. I'm sure many of you know that students in general, and that includes medical students, don't carry a very good reputation in the hospital. Many hospital staff are unwelcoming to us. And this occurs to such an extent that I seldom volunteer my status as a student because I know that I'll be treated differently if I do. So with that in mind, I'd like to tell you a story that took place in January of this year. I was rotating through trauma surgery, and it was my 8th day on the service. It was slow up until about 4:30 in the afternoon when a woman was brought into us by emergency medical services. She had run her car headfirst into a tree. She lost pulses in the trauma bay, so we started CPR, and one of the residents opened her chest in order to visualize her heart. But by the time she had done that, her heart was beating on its own again. So we rushed her up to the OR, and for 2 hours we worked to stop the bleeding in her belly. By the time it had abated, about 90 units of blood products had been poured into her. We tore down the OR and moved her onto an ICU bed. But before we could roll her out of the room, she lost pulses a second time. The residents and I re-entered her chest and did what's called cardiac massage, that is, squeezing her heart between our hands in order to pump blood through her body. We did so for 10 minutes until our attending told us to stop and give her heart a chance to beat on its own. So I relaxed my hands and waited, but her heart didn't beat, and it wasn't going to. He called time of death, and I stepped away from the bed, changed my gloves, and came back to the bed to sew up her chest. When I was done, I walked outside to wash my hands, and a tech that I passed thanked me so genuinely for trying that I felt undeserving of his kindness. A nurse that saw the entire end of the case came up to me, also thanked me, told me that I did a good job with the cardiac massage. She asked me if I was a resident, and I told her, no, just a student. She looked a bit perplexed. Are you in the military? No, just a civilian. And a look of what I can only describe as pity came over her face. She no longer met my eyes, she just looked at the floor before thanking me again and getting back to work. I made my way back down to the trauma bay, back down to all the people that I had been working with that day, but who had not followed us up to the OR. And when I got there, the thought crossed my mind that not a single person there knew that for the first time in my life, I watched somebody die. And I did so with her heart in my hands. My point is this, and it's applicable to you whether you're in medicine, nursing, dentistry, health professions, or research sciences. You can never truly understand what's going on in your colleagues' lives. So be kind to both your superiors and subordinates alike. I went to a talk recently given by a visiting surgeon, and he left us with a message that you own the wounds that you create. It doesn't matter that you felt like you were in the right, or that somebody made 5 extra minutes of work for you when you're already having a bad day, or even that maybe you didn't intend to be malicious. The results of your actions are your responsibility. Because if in the pursuit of relieving the suffering of our patients, we neglect to take care of ourselves and our peers, then we cheapen the very thing that we've worked so hard to accomplish. Thank you so much for your time.